Hello, everyone, and welcome to today's Health ISAC Navigator webinar. I'm Joshua Justice, Senior Cyber Threat Intelligence Analyst at Health ISAC's Threat Operations Center. Today's webinar will focus on the state of medical device cybersecurity. Cybellum conducted a survey of medical device security professionals regarding challenges protecting medical devices as well as solutions to mitigate those threats. Today's webinar will highlight the very interesting findings of the survey. Today's session will feature Gilam, Head of Product Marketing at Cybellum. I'll be making a few short remarks before we begin today's session. We would like to thank everyone for attending. We're certainly excited to see the large turnout, and we look forward to fielding your questions throughout the broadcast. There is a dedicated Q&A at the end of the presentation, but please feel free to share those questions throughout the broadcast. Again, we'll get to those at the end if we have time permitting, but if you have an idea or a question, don't be afraid to go ahead and share that throughout the broadcast. Today's session is being recorded and will be available for playback by members following the broadcast. And on that note, I'll pass it over to Guy. Guy?
Thanks, Joshua. Hi, everyone. I'm really excited to be here for this first educational session we're doing with the Health ISAC as a Navigator partner. During this session, I'd like to share with you some interesting findings we got from a recent survey we conducted regarding medical device cybersecurity. We look at the challenges and priorities of medical device manufacturers, and also at what ways they're using to keep the product secure. Now, as we have a lot to cover, I'd like to kick off this session by immediately sharing with you some interesting findings we got. We've asked survey participants how confident they feel in terms of their readiness for an attack on their medical devices. Now, this was the response. 33% respondents were 100% confident in their ability to handle and mitigate a cyber attack on their medical devices. 41% were quite confident, and a mere 1% said that they are not ready for that. Now, I find it truly surprising to see that almost all, 99%, say they have some level of confidence in their preparedness to cope with a cyber attack. But that's not all. We asked them also, how do you feel you're doing compared to your competition? And as you can see, 75% of respondents believe that they are better prepared to deal with a cyber attack compared to their competitors, with about 1/3 or 32% saying they are much better prepared. Now, I let these findings sink in a little, and I'll get back to them towards the end of our session. Now, just before we dive in, I'd like to briefly introduce you to Cybellum, to those of you that are not familiar with us. Cybellum is a cybersecurity company founded in 2016, focusing on securing connected devices and their components throughout their lifecycle. Last September, we were acquired by LG Electronics, and we remain an independently run company headquartered in Tel Aviv, Israel, with offices all over the world. We are proud to be working with leading device manufacturers and proud of our involvement in industry forums such as this one, the Health ISAC, the Florida Medical Manufacturers Consortium, and other forums and initiatives related to cybersecurity. Now, one of the key realizations we've had a few years ago when working with device manufacturers is that device software is essentially a living thing that keeps changing all the time, and we need to address its entire life cycle, from the design and development stage through integration and production to when medical devices are in operation used by health delivery organizations. And for us at Cybellum, it's part of our mission statement, as you can see it here on the slide, enabling medical device manufacturers and their suppliers to keep the products they build and manage secure every moment of their life. This is based on three main pillars, I would say: gaining complete visibility into the makeup and characteristics of medical devices and the context in which they operate, enabling SBOM or cyberbomb management, and going beyond that to get deep insight on device security. Continuous security, leveraging automation to scale product security with the growing complexity and attack surface of devices, enabling both vulnerability management during the long design and development phase to post-production incident response. And the third pillar is about staying compliant with regulations, standards, and internal policies via automated validation and documentation and reports in support of the compliance process. Now, as part of our desire to better understand what are the significant challenges and key priorities of device manufacturers in this space of product security, we commissioned this year a survey. We asked respondents in charge of product security or cybersecurity compliance in companies who are part of the medical device industry. As you can see, 45% of the respondents were actually medical device manufacturers. The rest, 55%, were their suppliers. Nearly 60% of those came from companies with 5,000 to 10,000 employees. 10% more came from larger companies, while the rest were from smaller companies. The survey was completed by an independent survey company called Global Surveys, and respondents were recruited through an email, through a global B2B research panel invited via email to complete the survey. As you can see here, most of the respondents were pretty senior. 30% of them were director level, 25% were VPs or heads of, and so on and so forth. Most of the respondents came from US-based companies, followed by German companies, Danish companies, Japanese, British companies, and so on and so forth. So we had an interesting array of companies answering our survey. So let's dive into the key challenges and priorities as identified by this survey. So the top device security challenge for 2022, according to our survey, is the growing set of tools and technologies and processes at 45% of respondents. This was followed by the challenge of continuously managing security across the device lifespan at 43%, and then assessing the business impact of security issues on the organization. Another notable challenge is gaining better visibility into security risks affecting devices. And I think a key takeaway from this survey relates to the siloed and fragmented processes and tools. These are much less efficient and effective and limit the ability to assess the business impact of device security in the organization as a whole. Fragmented processes and tools also limit visibility. They limit the ability to do continuous management of security, tracking resolution, efficiency, and more. This may sound like a technicality, but it actually has quite an impact. Another interesting thing to notice is the larger the company, the greater the challenge of continuously managing security. We've noticed that this challenge is actually increased by 42% when slicing our survey to companies above 5,000 employees to those with less than 5,000 employees. So while small companies can remain agile, larger companies experience more of a struggle in this area. Now, one thing that I found personally a bit surprising was that scale was ranked at the bottom of this list. Given the increase in cyber attacks and latest legislative and regulatory developments, I thought it would be higher, but those are the findings. Now, let's look at what could be seen as the flip side of this coin. What are the top priorities of device manufacturers? So the top priorities for 2022 are establishing an overarching device security governance practice, integrating security earlier in the design and development stage, what we call shift left approach, and improving compliance, followed by building an incident response team. Now, there are a few things worth noting here. First, it seems like medical device manufacturers are looking to be more proactive about product security, shifting left, dealing with security earlier in the design development process, wanting to improve governance and management, and looking to build a dedicated product security incident response team. It's also interesting to note that supply chain security is somewhere in the middle of this list. Maybe a bit surprising given the latest focus on this issue, and also notice that tool and technology unification is not listed here as a top priority, even though, as we just showed previously, it was noted as the top challenge. One last thing is, if you notice the two bottom items on the list, It seems that companies seem to lack some innovative new approaches to automate product security, as they prioritize it fairly low. And also it seems that they have given up on increasing headcount, maybe because of the widespread shortage in talent, maybe because it's realized it's not enough to solve the problems. I'm not 100% sure, but those are ranked pretty low on the list. Compliance is an issue, and we've also asked respondents which regulations do they invest in, and these are the results. And it was interesting to see from a certain sense, the lack of compliance of many medical device companies. I mean, the top regulation complied with is the FDA's content for pre-market submissions, and yet it's fully complied with by just 54%. 46% are not compliant with today. On the positive side, I would note that the NTIA's fairly recent critical elements of software bill of material, which is give or take a years old, is right after it with 51%. And the one final thing I would note is that it looks like the focus for the upcoming for this year is more around the IMDRF's principles and practices for medical device security, where 52% of respondents noted that it's a priority for them in this coming year. Now, moving on to interesting stuff like budget, money. 99% of the companies have increased their device security budgets in this past year. You can see that 50% of them increased their budget by up to 25%, and almost a similar number increased their budget by over 25%. On average, the increase between 2021 and 2022 is 29%. I think it's no surprise the increase in cyber attack during the pandemic, Biden's executive order on prioritizing cybersecurity has made product security top of the agenda, and we expect to see budgets for cybersecurity to continue to increase as the attack surface of medical devices expands. Now, what are the drivers for this budget increase? As you can see, the respondents indicated that the top drivers that would influence their organization to increase their security, their budget, the device security budget, are security incidents involving another medical device manufacturer, topping in 43, together with a desire to leverage device security as a competitive edge and a business enabler, and a concern over potential damage to their brand. I do find it somewhat surprising that security incident response affecting their own devices was ranked lower than incidents affecting their competitors, but nonetheless, these are the findings. I think what it clearly shows here that companies are thinking from a business-minded approach, and you know, they are aware of that business drivers are the main drivers or catalysts for increased budgets more than regulation or even loss of life. So that's an interesting finding. Cybersecurity professionals are very business-minded. Now, we also asked them, what's your attitude towards device security, or how it is perceived, device security is perceived internally. And as you can see, most of device security is a competitive advantage. It's important to minimize risk and protect their brand, and also being critical to protecting their intellectual property. Now, this looks quite promising, but we also uncovered a lot of opposing views when it comes to device security. 80% think that device security is a necessary evil imposed by regulators. Almost a similar number do the bare minimum to achieve compliance and believe time to market wins over device security. So perhaps this is a sign of not taking device security too seriously and instead companies are focused on getting product quickly to market. I'll let you be the judge of that. Now, let's quickly look at how device manufacturers keep their products secure. So this one is actually very interesting. 25% of companies have a dedicated chief or VP or head of device of product security, who is the most senior owner of medical device security in their organization. I might add just 25% of those. 25% of those have this, or slightly less than that, have the CTO as the top owner, and then that's followed by a QA, quality assurance executive, heads of compliance, heads or VPs of R&D or engineering, and telling at the end are CEO and COO and even the CIO. So I think it's clear why companies are lacking governance and oversight, which we mentioned earlier on. Most don't have a dedicated senior for device security that takes care of things and handles things and reports to the executive management on this, making it a priority. But beyond organizational challenges, let's put it that way, we also asked, how do you keep your medical devices secure? Now, there are many processes and tools that could be used to strengthen device security, but what the data shows that usage is actually quite low, I would say, with less than half of respondents using any one method. While binary scanning tops the list at 47%, that still leaves 53% not currently using this analysis tool to validate the security of their code and detect risks in the supply chain in the absence of having the source code. In a similar vein, if only 46% are setting security requirements during the design phase, that means that 54% are not working to shift left on security and move it earlier in the process. Now, we can also see a very low adoption of generating and maintaining and managing software bill of materials, or SBOMs, at just 27%. But when looking into the data segmented by the type of company, SBOM management is much more popular with manufacturers at 34% compared to suppliers of medical devices, device components at 20%. Now, this could be because the ultimate responsibility for safety and security of devices lands on the manufacturer, which could explain why they make it a priority. Now, of course, regardless of the segmentation, both audiences have a long way to go. Now, what are the most the areas in which device manufacturer needs to improve on the most, areas that are most exposed or they need to improve on? So, what I found funny and annoying is that 13% claim that they have nothing to improve on, which I find quite amazing. But the other 87% of the survey responded admitted they do need to improve in certain areas. As you can see here, SBOM generation and management tops the list together with compliance, followed very closely by incident response, managing known vulnerabilities or CVEs, open source licensing policy enforcement, and threat assessment and remediation analysis, also known as TARA. Now, TARA, threat assessment and remediation analysis, for some reason, as you can see, is a key area of improvement for North American companies, less so for German, and to be honest, with the rest of the companies around the world. I'm not sure 100% why, but do note also that that this is relevant also for an area of more improvement for smaller medical device manufacturers, at 48%, stating that, compared to larger one. Now, my assessment or my feeling is this is because performing threat assessment and remediation analysis is a very complex process. It requires expertise, it requires resources, and possibly smaller players don't have these resources and expertise, while large ones might have so. Now let's look at device security testing frequency. A large majority of respondents do not use continuous testing. When I say continuous testing, I refer to testing their software security every build. It could be daily, it could be weekly, as opposed to once a month, or a few times at critical points throughout the development process, or as some do once right before production, and unfortunately some even never do so. So while DAST, dynamic application security testing, tops our chart, only 35% of respondents continually use that and binary code analysis. The rest of the companies seem to be testing their code once a month or even less. Now, a stat that's not here, but you'll be able to read about it in our report, is that interestingly enough, the larger medical device manufacturers perform fewer security tests in comparison to smaller ones. For source code scanning, 57% of the smaller companies, smaller meaning have a headcount below 5,000 employees, perform continuous or monthly scans, and only 45% of the larger companies do so, 57 versus 45%. For binary scanning, 41% of smaller companies responded they perform it continuously, while only 33% of the larger companies do so. So regardless of size, it seems that there's a lot of room for improvement here. Now, finally, let's look at how do companies maintain device security after launch. When asked which initiatives and practices companies employ to keep medical device secure after the launch, most state that they're monitoring the NIST, National Vulnerability Database, or the MITRE CVE database at 46%, followed by having a dedicated product security incident response team at 45%, and collaboration with industry information platforms, government bodies and search formers at 40%. Now, two things pop out of this list. Now, I have to be completely honest. I find it quite surprising to see that just 38% currently implement security updates, which is really a basic and essential preventative measure. In fact, regular software security updates are more prevalent at smaller companies at 60% compared to 29% for bigger companies. It's quite clear that smaller companies are more agile and increasingly able to adopt and utilize updates in a nimble way. The second issue is that 39% of companies say that they do not currently take any proactive measure or approach to post-production device security upkeeping. This is a very dangerous approach for medical devices that are looking to keep their products and their patients safe and reduce the risk for the business. So I find it quite surprising, and I believe so would you. So let's wrap things up. You remember this slide that I showed you at the beginning? I wonder what you think about it now. Is this high confidence level justified or not? Based on the survey data and our discussions with industry experts and with our customer partners, it feels like this level of confidence can't be easily explained. The fact is that today devices are no longer simple mechanical and electrical parts combined together. There are software-driven machines, which means their exposure to cyber risk is not static. It keeps changing all the time throughout the entire life cycle. So making sure they remain safe and secure has really become a never-ending struggle. And if on top of that, you add the number of product lines that you have, the different products, the models, the variants, it really becomes a complete mess to manage device security. I think the survey results that I've shared with you today back this up. Continuously managing device security is a major challenge for the industry, and the fact that multiple tools and technologies and fragmented processes are involved make this much more difficult tasks. Many device manufacturers are not complying with some of the notable cybersecurity regulations and standards, but we see this as, we do see this on the roadmap. And the latest, I'm pretty sure the latest regulatory and legislative developments will likely improve the situation. On the other hand, device security is seen as the competitive edge, and budgets are increasing, used to improve the product security posture of the companies and devices and help them become more proactive about product security. Finally, we found that medical device manufacturers might think they're ready to cope with cyber attacks, but fact says otherwise. That's it from my end. I'm happy to take some questions. I'll just add that if you'd like to receive our full survey report and dive into it, do shoot me an email and I'll be happy to share it with you. You can see it here now on the screen. Back to you, Joshua. Are there any questions?
Sure. Thanks, Guy. That was very insightful. Let me take a look and see if we have any questions from our membership. Again, please do not hesitate to share your questions in that Q&A feature of the video. It does look like we have a couple questions here. So I'll go ahead and start out with the first one. When was the survey done? How many respondents?
Joshua, can you hear me?
Yes, I can hear you. Can you hear me? Hey, are you able to hear me okay?
Oh, no, I can hear you.
Can I get an audio check? Can you hear me okay?
Yes, I can hear you.
Okay, so it looks like we got a few questions in here. Let me go ahead and share that first question with you. When was the survey done and how many respondents did you have?
Okay, so the survey happened in February this year with a couple of hundreds of responses, but some were disqualified due to fraudulent answers and qualification issues. So, that's more or less about it.
Okay, let me just take a look here and see if we have any other questions in the queue. Looks like we do. This one here, in some of your findings, for example, the slide on the methods for keeping devices secure, the numbers don't add to 100%. Why is that?
Good point. I should have mentioned that earlier. For that question and a few others, the respondents had to select more than one answer. So like in this question, it was like choose the top 3 methods used to keep your product secure. So in some of the questions, the numbers don't add up to 100%.
Okay, we've got a couple more questions here. So it seems from the survey that there is a long way to go for medical device manufacturers to get their product security to where it needs to be. Do you see it this way as well?
Indeed, it does feel like some good things are happening. There certainly seems to be greater awareness to device security, but much needs to be improved. We are hearing this quite regularly through our engagements with the industry, with experts, with customers, and possibly with partners.
All right, great. Looks like we've got 2 more in here. What would you recommend to manufacturers as best practices for securing their devices?
Good one. I think it starts with the basics in a certain sense, getting the right people, the processes, and the technology, having dedicated owners for product security, having the right processes and tools to enable governance and oversight, being proactive about cybersecurity and investing in a shift left approach without neglecting the very important post-production security monitoring and upkeep. So, these are basic stuff, but you really need to take care of those. I think leveraging automation for scale is one of the clear things you need to focus on. It's pretty clear that things will become tougher, and you can't rely on what are today predominantly manual processes. So automation is definitely going to be the key. I'm pretty sure that the recent heightened oversight from legislators and regulators, and recently we saw the new release of the FDA guidance on cybersecurity, will drive things in that direction, and companies will need to adopt a more product-centric approach to their business.
All right, great. And I've got one last question here. Do you intend on conducting the survey again? And how often to gain insights over time from the sector?
That's a good question. I think that we may do another one next year. But again, we'll have to see if there are any major developments in the market, in things. We might do it earlier than that.
Okay, great. Looks like that answers all the questions we have in the queue. Guy, do you have any final thoughts you'd like to share?
No, thank you very much. I hope you found this session interesting. I think there are definitely interesting points here to consider if you're a medical device manufacturer. It's good to know what people are doing out there. And I'll remind you once again that if you do want to get access to the full report, just shoot me an email. My email is guy@cybellum.com, as you can see on the screen, and I'll be happy to share it to you when it's available in a few short days. That's
Wonderful.
it for mine.
Thanks a lot. Sure. And with that, thanks to everyone for joining and participating. Special thanks to Guy Gilam from Cybellum. We really appreciate the survey results shared today. And thanks to everyone for your participation, and we hope you'll join us for our next webinar event. Thanks, everyone.